Hey everyone, welcome back. We're going to do a deep dive into the world of transgender awareness and affirming care today.
Ooh, exciting.
Yeah, so we've got this incredible guide from Trans Leadership Alaska.
Oh, yeah.
And it's, I gotta say, it's just packed with insights.
Yeah.
You know, it's really eye-opening how much we can all learn about the transgender experience, especially when it comes to healthcare.
Yeah, and I think what's so cool about this guide is it really doesn't just scratch the surface, right? It dives right into the heart of the matter.
Yeah.
Giving us this really solid understanding of what it actually means to be transgender.
Mm-hmm.
And how that kind of plays out, especially in a healthcare setting.
Yeah, I totally agree. And it made me realize it's like there are so many nuances that I hadn't even considered before.
Right.
Like, for instance, the guide really emphasizes this difference between sex and gender, which is something that I think a lot of people get confused about.
Yeah, definitely a lot of confusion out there.
Yeah.
And they lay it out so clearly in the guide. They say, sex is the body we have. Assigned gender is what we were told we were at birth. Gender identity is how we see ourselves.
Mm-hmm.
Just such a powerful distinction that really kind of gets us thinking outside of those common misconceptions.
Yeah, and it's kind of like, you know, you might be given a blueprint at birth.
Oh, yeah.
But you get to design the actual house, right?
Yeah. Mm-hmm.
Like it's your identity, your experience.
Exactly, yeah. And that's where I think terms like transgender, right, really come in. And the guide defines it as when someone's gender identity differs from the sex they were assigned at birth.
Right. And then there's gender nonconforming, which I found really interesting.
Yeah.
It describes folks who, you know, don't fit neatly into those traditional boxes of male or female.
Yeah, it really highlights that gender isn't this black and white thing, right?
Right.
It's like this whole spectrum of diverse expressions and identities.
Yeah. Forget the boxes. Let's embrace the rainbow.
Totally, totally. And understanding this spectrum is so crucial, I think, because it helps us move beyond these rigid societal norms.
Right.
And just embrace the beautiful diversity of human experience.
Yeah, it really does. Now, shifting gears a bit, the guide also delves into why transgender individuals might seek specific health care.
Right. Yeah, and you know what's interesting is it's not always about transitioning.
Right.
A lot of transgender people just need general health care like anyone else.
Mm.
But that's where the guide kind of reveals some, honestly, some really alarming statistics from the 2015 U.S. Transgender Survey.
Oh, yeah. I was, blown away by some of these numbers.
Yeah.
Did you know that 39% of transgender individuals reported experiencing serious psychological distress in the past month?
Wow.
Compare that to only 5% of the general U.S. population. That's a huge disparity.
It's a massive difference. And those numbers are probably even higher now, considering the kind of increasing levels of discrimination and violence that, targets the transgender community. The survey also found that 40% of transgender people have attempted suicide in their lifetime.
Oh, wow.
Which, again, is just so much higher than the national average.
Yeah, it's heartbreaking to hear that. It makes you wonder, what's at the root of this?
Right. It's complex.
Yeah.
But I think the guide does point to some really significant factors.
Okay.
A lot of transgender individuals experience, rejection from their families.
Right.
Discrimination in employment, housing, and even violence simply for being who they are.
Yeah.
This constant trauma and lack of acceptance, can have really devastating effects on mental health.
Yeah, it's a reminder that, words and actions have real world consequences. Mm-hmm. And that unfortunately, even just seeking health care can be a source of trauma for some transgender people.
Yeah, exactly. The guide says that a shocking 44% of transgender individuals had at least one negative experience with a healthcare provider, leading to, things like fear and avoidance and just further jeopardizing their well-being.
That is incredibly concerning. Can you talk a little bit more about what those negative experiences might entail?
Yeah. So, imagine going to a doctor and being misgendered,
right,
having your identity dismissed, or even just being denied care because you're transgender.
Yeah.
Those experiences can be so traumatizing, especially when you're already feeling vulnerable.
Right.
You're seeking help. And sadly, it often goes beyond, insensitive remarks. Some transgender people face outright discrimination, like being refused treatment or facing exorbitant costs for gender affirming care that isn't covered by insurance.
And it's appalling. So it's we're seeing this combination of societal stigma, discriminatory practices, and systemic barriers that create this perfect storm of challenges for transgender people.
Yeah.
Just trying to seek healthcare.
Yeah.
No wonder so many are hesitant to even like step foot in a doctor's office.
Exactly. And this is, I think, where this concept of affirming care becomes so important.
Right.
And the guide defines it as healthcare that is respectful, welcoming, and inclusive of transgender individuals and their unique needs.
Okay, so it's not just about like providing medical treatment. It's about creating a space where people can feel
safe,
seen, heard, respected.
Yeah, it's about acknowledging their lived experiences, validating their identities, and ensuring they have access to the care they need without that fear of judgment or discrimination.
It sounds like affirming care isn't just about being nice, but it's about fundamentally changing the way we deliver health care to be more inclusive.
Yeah, it's about creating a system where every individual feels valued and respected.
Right.
Regardless of their gender identity.
So I'm curious to learn more about the practical side of this. Like, how does affirming care actually look in action?
Ooh, great question. Let's dive into that in the next part of our deep dive.
Sounds good. So we just talked about like the huge challenges that transgender individuals face in healthcare. And it's clear that like things need to change.
For sure. Yeah.
But the good thing is that this guide doesn't just point out the problems.
Right.
It also offers solutions.
Yeah.
So like it dives right into the practical side of things, right? With this whole section on affirming care and like what that looks like in action.
Yeah, absolutely.
And it starts with something that seems so simple, but is actually really powerful.
Right.
Using the patient's chosen name and pronouns.
It makes such a difference.
It does. You know, it's funny because we've talked about the power of names and pronouns before on the show.
Yeah.
But in this context, it just feels even more important.
Oh, yeah.
It's not just about being polite. It's about like affirming someone's very identity.
Exactly. For a transgender person, having their chosen name and pronouns recognized can be incredibly validating.
Yeah.
It sends the message that you see them, you respect them, and you're creating a space where they can actually feel safe and comfortable being themselves.
Yeah. And the guy actually gives specific phrases for providers to use, like, what name would you like me to use?
Oh, that's so good.
Yeah. What pronoun would you like me to use? It just seems so straightforward, right? But I can imagine those questions making a world of difference for someone who's, you know, so used to being misgendered.
Yeah, or having their identity ignored. Totally.
So it's not just about asking the right questions.
Right.
It's about being mindful of the entire interaction. Like, for instance, the guide also talks about the importance of being sensitive to your potential outing risks.
Yeah, such an important point.
Not every transgender person is comfortable disclosing their transgender identity, like to everyone.
Right.
So providers need to be really careful. Right? To not reveal that information without the patient's consent.
Definitely. It's all about respecting people's privacy and, autonomy, and not making them feel like they have to share something that they're not ready to share.
Yeah, for sure. What other practical tips does the guide offer?
Well, it really emphasizes the importance of training staff on transgender sensitivity and awareness.
Yeah.
It's not enough for, just one doctor or nurse to be informed.
Yeah.
Everyone in the healthcare setting should be, equipped to interact with transgender patients in a respectful and inclusive way.
So it's about creating this culture of inclusivity where, everyone from the receptionist to the nurses to the specialists understands the nuances of gender identity and affirming care.
Exactly. And it's it involves more than just knowing the definitions, right? It's about fostering empathy, challenging our own biases, and just learning to approach every single patient with compassion and understanding.
It sounds like it requires a real shift in mindset, like moving away from these binary assumptions that we've been conditioned to make. The guide also talks about this idea of ongoing learning and self-compassion. Yeah. Can you talk about that a little bit?
Yeah. So, we're all on a learning journey here, right?
Yep.
No one is expected to be perfect from the start.
Right.
So the guide really encourages providers and actually everyone to, approach these conversations with humility and a willingness to learn. It's okay to not have all the answers. Yeah. It's okay to make mistakes.
Yeah.
And to admit when you need more information.
Yeah, I love that. I feel like sometimes we get so caught up in trying to be politically correct
Yeah.
That we're afraid to, like, ask questions or admit when we don't know something.
Right.
So this permission to be imperfect is, like, so freeing.
Totally. And it's also important to remember that language is constantly evolving. So what might be considered appropriate today, could change tomorrow.
Right.
So the key is to be open to feedback.
Yeah.
To listen to transgender individuals and their experiences.
Right.
And to be willing to adapt our language and practices accordingly.
So it's about being flexible and adaptable.
Yeah.
And realizing that, inclusivity is this ongoing process.
Totally.
Not like a destination.
Mm-hmm. And the guy even encourages providers to be, transparent with their patients about this learning process. Like, admitting that you're still learning can actually build trust and rapport, right?
Oh, for sure.
It shows the patient that you're committed to providing the best possible care.
It's about vulnerability and honesty.
Mm-hmm.
Which I think are so powerful in any relationship, but especially in healthcare, right?
Yeah, for sure.
Where vulnerability is just so inherent.
Mm-hmm.
Okay, so what other concrete examples of affirming care does the guide provide?
One thing that really stood out to me was the emphasis on addressing the whole person. Yeah. Not just their gender identity. It's easy to kind of fall into this trap of assuming that every healthcare need a transgender person is somehow related to their transition.
Right. Like, we can't forget that, a trans woman still needs a pap smear.
Exactly.
Or that a trans man might need a prostate exam.
Right, exactly. And the guide reminds us that, transgender individuals have the same basic healthcare needs as anyone else. And those needs should be addressed with the same level of care and attention.
So it's about seeing the person beyond their gender identity.
Yeah.
And just ensuring that they receive, like, comprehensive, inclusive health care that addresses all of their needs.
Absolutely. And the guide offers some practical tips for navigating these conversations in a sensitive and affirming way. For example, instead of asking, were you born a boy or girl? A provider might phrase it as, what sex were you assigned at birth?
Oh, I see. So subtle.
Right.
But so powerful.
Yeah, it's just a small change in language. But I think it makes a really big difference,
Yeah. It acknowledges that a person's assigned sex at birth might not align with their gender identity. And it avoids reinforcing that, binary assumption.
Exactly. It's about recognizing that language has power. And that even small changes in the way we phrase things can create a more inclusive and respectful environment.
Right. I'm also curious about something.
Yeah.
So the guide talks about how transgender individuals may have had negative experiences with healthcare providers in the past. How does that factor into providing affirming care?
That's such a good point. The guide emphasizes that providers really need to be aware that those past negative experiences can really affect a transgender person's willingness to seek care, their interactions with the medical staff, and even their responses to questions or procedures.
Yeah, so it's not just about providing affirming care in the moment, right?
Right.
It's about recognizing and addressing the potential trauma that a lot of transgender individuals bring with them into the healthcare setting.
Exactly. It requires this heightened level of sensitivity, patience.
And a willingness to build trust, right?
Yep.
So that might mean taking things slower, providing more explanation,
right,
and constantly reassuring the patient that they are in a safe and supportive space.
So building that trust is foundational to providing effective care.
Yeah.
Especially for people who might have been, dismissed or mistreated in the past.
Absolutely.
Yeah.
And that trust is built through consistent actions.
Right.
Not just words, right?
Right.
It's about demonstrating respect, empathy, and a genuine commitment to the patient's well-being.
It's interesting how the guide emphasizes that these principles of respect, understanding, inclusivity, they're not just for healthcare providers, they're for everyone, right?
Yeah, absolutely.
It's about creating a more welcoming and affirming world for transgender people in all aspects of life.
Totally. These principles apply to our interactions with colleagues, friends, family members.
Strangers we encounter in our daily lives,
Yeah.
It's about recognizing that gender identity is a fundamental part of who we are.
Right.
And treating each other with dignity and respect, regardless of how we identify.
So it's not just about changing policies or practices.
Yeah.
It's about changing, hearts and minds.
Right. And that change starts with education. challenging our own assumptions and biases, and actively listening to the experiences of transgender individuals.
You know, it strikes me that this guide is so much more than just information, right? It's about empowerment.
Yeah.
It's about action.
Right.
It's giving us the tools to be better allies, to create more inclusive spaces.
Yeah.
And to advocate for change on a larger scale.
Totally agree. And it emphasizes that, like, you know, you don't have to be an expert to make a difference. Like, even small acts of kindness, like using someone's correct name and pronouns can have a huge impact.
It's about those everyday interactions where we have the opportunity to, like, really affirm someone's identity.
Yeah.
And just create a more welcoming and supportive environment.
Exactly. And the guide also encourages us to not be afraid to speak up when we see injustice happening, to challenge discriminatory language or behavior, and to use our voices to advocate for change.
So it's about recognizing that we all have a role to play in creating a more just and equitable world for transgender individuals.
Absolutely. And that brings us back to kind of the core message of this whole deep dive, which is that affirming care is not just about healthcare, it's about human care.
Yeah, it's about recognizing the inherent worth and dignity of every person, regardless of their gender identity, and just creating a world where everyone can, like, truly feel seen, heard, and valued for who they are.
I think that's a perfect way to kind of segue into the last part of our deep dive.
Right, yeah.
Yeah.
Okay, so as we wrap up this deep dive into transgender awareness and affirming care, I keep coming back to those statistics that we talked about earlier from the 2015 U.S. Transgender Survey.
Yeah. Yeah, they're pretty hard to forget.
Yeah, like the fact that 39% of transgender individuals reported, you know, experiencing that serious psychological distress in the past month.
Right.
Compared to only 5% of the general U.S. population.
It's a huge difference.
It's huge. And it really highlights the impact of, like, all the discrimination and the prejudice and the lack of acceptance.
Absolutely. And, you know, it's scary to think that those numbers are probably even higher now, considering, like, the increase in anti-transgender legislation and just the rhetoric that we've been seeing.
Yeah, it's a disturbing trend for sure.
It really is. It's creating this climate of fear and hostility for a lot of transgender people, and we can't downplay the effect that, like, this constant negativity has on their mental health.
It's like this never-ending cycle of stress and trauma.
Yeah, exactly.
And then, like we talked about, that trauma spills over into healthcare settings. It makes it even harder to access the care they need.
Exactly. It creates this vicious cycle, right? Where fear and mistrust of healthcare providers, along with those systemic barriers and the discriminatory practices, prevent transgender folks from actually getting the help that they need.
It's really sad because it doesn't have to be this way.
Not at all.
Like this guide from Trans Leadership Alaska, it really gives us a way forward. It gives us concrete steps that we can take to make things better.
Absolutely. And I think it starts with kind of a shift in perspective. You know, we need to move away from this idea that transgender healthcare is somehow, like, separate or specialized. And instead, we need to think about integrating it into just, like, mainstream healthcare.
So it's not about creating separate clinics or programs or whatever. It's about making sure that every single healthcare provider, regardless of their specialty, is equipped to provide, you know, culturally competent and affirming care to their transgender patients.
That's exactly it. It's about recognizing that transgender health is just health, and that everybody deserves access to quality care that meets their unique needs.
Right.
And like we've talked about, that care needs to go beyond addressing just the physical, right? It has to address the emotional and social well-being of the person, too.
Yeah, treating the whole person, not just the body.
Exactly.
And understanding that, like, for so many transgender individuals, affirming care isn't just about feeling comfortable. It can actually be life-saving.
It really can. When transgender people have access to affirming healthcare, it can, like, drastically reduce their risk of things like mental health issues, substance abuse, and even suicide. It can truly be the difference between life and death.
It makes you realize that it's not just a nice thing to do. It's like a moral imperative.
It really is. It's about recognizing that inherent dignity and worth of every human being, no matter their gender identity, and making sure they have access to the resources and support that they need to thrive.
So where do we go from here? Like, how do we take these principles of affirming care and and make them real?
Yeah, that's the big question, right? Well, the guide gives us a ton of recommendations for both healthcare providers and for society as a whole. So for providers, it's about actually implementing those practical tips that we talked about before, like using chosen names and pronouns, being mindful of those outing risks, providing really comprehensive training on transgender sensitivity, and just constantly trying to create a more welcoming and an inclusive environment for everyone.
And I think beyond healthcare, it's also about challenging those harmful stereotypes and misconceptions that lead to discrimination in the first place.
Right, like speaking up when we hear transphobic language, educating ourselves and others, and advocating for policies that protect the rights of transgender folks.
Absolutely, and I think it's also about supporting the organizations that are doing that great work on the ground, like Trans Leadership Alaska.
Yes.
They provide so many resources and so much support.
Yeah, for transgender people and their families.
Yeah, it's about recognizing that this is a collective responsibility, that we all play a part.
Yes.
In creating a world where transgender people feel safe and valued and affirmed.
Absolutely.
And it starts with, those everyday interactions, those little acts of kindness and understanding that can actually have a huge impact.
I love that. It's like a reminder that we don't have to be experts to make a difference.
Right.
Sometimes the most meaningful things are actually the simplest.
Yeah, like offering a smile or using someone's correct name or just listening with an open heart.
It's about creating those like ripple effects of kindness, right? That can actually transform communities and even the world.
I think that's beautifully said. I think this deep dive has given us a lot to think about and a lot of inspiration to carry forward.
I agree. And as we wrap up, I want to leave everyone with this thought.
Okay.
We each have the power to make a difference. So let's use our voices, our actions, and our influence to create a world where gender identity is celebrated, not stigmatized, and where everyone can live authentically and freely.
That's beautiful. Thank you so much for joining us on this journey of learning and discovery.
Thanks for having me.
And until next time, keep diving deep and keep pushing for positive change.